Welcome back to Health Talk, where we break down complex medical topics in a way that's easy to understand. Today, we're diving into a topic that affects millions worldwide: lymphoma cancer. This disease can be overwhelming for patients and their families, but we're here to explore how it can be treated, what the options are, and how doctors are working to improve outcomes for lymphoma patients. To help us understand more, we're joined today by Miss Sophia, an oncologist specializing in lymphoma. Miss Sophia, welcome to the show.
Thank you, Michael. I'm excited to be here and to have the chance to discuss lymphoma and its treatments with your listeners.
Absolutely. So, Miss Sophia, let's start with the basics. Lymphoma, can you briefly explain what it is?
Of course. Lymphoma is a type of cancer that originates in the lymphatic system, which is part of our immune system. The lymphatic system includes structures like the lymph nodes, spleen, and bone marrow. When lymphoma develops, it causes certain immune cells, called lymphocytes, to grow abnormally. There are two main types of lymphoma: Hodgkin lymphoma, which is rarer, and non-Hodgkin lymphoma, which is more common. The treatments for both types have some overlap, but there are also key differences.
Got it. So, how is lymphoma treated? Are there different approaches depending on the type?
Yes, definitely. The treatment for lymphoma depends on a few factors: the type of lymphoma, its stage, and the overall health of the patient. The most common treatments include chemotherapy, radiation therapy, targeted therapy, and stem cell transplants. Chemotherapy is one of the mainstays of treatment for lymphoma. It uses powerful drugs to kill cancer cells, especially when the cancer has spread to other areas. Radiation therapy, on the other hand, is usually for cases where the cancer is more localized, for example, a single lymph node. Targeted therapies are a newer class of treatments that specifically target cancer cells while minimizing damage to healthy tissue. And then, for patients with more aggressive types or relapsed lymphoma, stem cell transplants can help regenerate healthy bone marrow after high-dose chemotherapy.
That sounds like there are a lot of effective treatments available. What advancements have you seen in lymphoma treatments in recent years?
One of the most significant advancements has been the development of targeted therapies. For example, drugs like rituximab, which target specific proteins on cancer cells, have greatly improved outcomes for patients with non-Hodgkin lymphoma. These therapies allow us to treat lymphoma more precisely and with fewer side effects compared to traditional chemotherapy. Another major breakthrough is immunotherapy, which harnesses the body's own immune system to fight the cancer. It's been especially effective for some patients with advanced lymphoma. There have been a lot of exciting studies and clinical trials showing the potential for long-term remission with immunotherapy.
That's fascinating. So, with all these treatment options available, how do doctors decide which approach is best for each patient?
Great question. The key to treating lymphoma is personalization. After we diagnose lymphoma, we stage the cancer to determine how far it has spread. We then take into account factors like the patient's age, overall health, and any previous treatments they've had. From there, we create a tailored treatment plan. Some patients may only need chemotherapy, while others may require a combination of treatments like chemotherapy plus radiation or targeted therapy. It's also important to assess how well the patient responds to treatments, so we can adjust as needed.
So it sounds like no two treatment plans are exactly alike. Now, for listeners who might be dealing with lymphoma themselves or supporting someone who is, what advice would you give?
I would say to remain hopeful. Lymphoma is highly treatable, and many people live long, healthy lives after treatment. I also encourage patients to be open and honest with their healthcare team about how they're feeling, both physically and emotionally. It's also okay to seek a second opinion or ask about new treatment options, especially if the lymphoma is difficult to treat or has relapsed. And don't forget the importance of support networks. Family, friends, and support groups can make a huge difference in a patient's journey.
That's such important advice. Before we wrap up, Miss Sophia, is there anything else you'd like to share with our listeners about lymphoma or its treatments?
I'd just like to emphasize that lymphoma is not a death sentence. While it can be a serious diagnosis, treatment options are better than ever, and many patients achieve complete remission. I also encourage everyone to stay informed and advocate for themselves or their loved ones. If you're unsure about anything, reach out to your healthcare provider. We're here to help.
Thank you so much, Miss Sophia, for sharing your expertise with us today. It's been incredibly insightful.
Thank you for having me, Michael. It's been a pleasure.
And thank you to all our listeners for tuning into Health Talk. If you or someone you know is facing lymphoma, remember that there are many treatment options available and that progress is being made every day. Stay informed, stay hopeful, and always reach out to a healthcare professional for support. Until next time, take care of your health.